This was the headline from the Rocky Mountain News in Colorado on July 6th, 1978. Disabled snarl traffic in protest. About 25 disabled persons seized 2 buses during Wednesday morning's downtown rush hour, snarling traffic and daring police to make arrests. Quote, shortly after the 8:30 a.m. takeover, police arrived, admitting they were not sure what to do. As police commanders came to assist on scene, police officers decided not to arrest any of the handicapped protesters because, as one sergeant said, quote, we don't want to be the fall guys on this. They wanted to be able to ride the bus in Denver just like everybody else, even though they used wheelchairs. Able to ride the bus.
It's really scary because you don't know what's going to happen.
The 74-year-old has been living in this nursing home for 11 years, first on private insurance, now on Medicaid.
We need that in order to make the program viable and to deal with these massive deficits and the mounting debt that we have.
Medicaid covers 20% of Americans.
Many people that are perfectly middle class or even upper middle class when they retire, by the time they find themselves 80 or 85, they've spent down and they don't have any funds.
In Denver, the very next week, same kind of protest happened in San Francisco. Again, this simple demand, let us ride the freaking bus. We're taxpayers. We pay for it just like everybody does. Make it accessible for us. We are citizens. You also saw similar protests in New York City. You saw similar protests in Washington, D.C. You saw protesters in wheelchairs turn up at particularly relevant national conventions like the American Public Transit Association convention. Hey, meet your wheelchair.
This city, they feel they've been isolated from society for too long. They want more opportunity for education and jobs.
To insist that we have a lot to contribute to America, if only America will give us the chance to make that contribution.
My name is Jan Brown. We are getting our interview.
You know my name.
Talmadge Wells.
Yeah.
Talmadge.
Yeah, she's a salty
Well, yeah, 67, and he's 65. I was a kid back in the dark days before they knew about premature birth. What they did is to put us in incubators and give us too much oxygen, which messed up the optic nerve, but nobody knew that. I was just a little kid, a little baby, minus 3 months or so. Anyway, and he was born with his blindness as well, but they don't know why.
My name is Pat Townsley, and I'm 52 years old. I believe Congress should pass a law to protect health care of disabled Americans. Medicare, Medicaid, is a quarter of what Americans use. However, I think there need to be some guidelines around what the definition of disabled is so that these programs don't get slaughtered with people who may or may not have actual disabilities and actually need the coverage.
Tonight, President Trump and House Republicans are celebrating what they are calling a major victory. Today, the House passed by a whisker the GOP health care bill.
The gains that we've made are there. 20 million people have health insurance that didn't have it before. The uninsured rate is the lowest it's ever been. The rise in health care costs since Obamacare, the Affordable Care Act, was passed, have been at their lowest rate in 50 years. All that progress can be undone, and suddenly 20 million people or more don't have health insurance. But, as I think Republicans now are recognizing, that may not be what the American people, including even Trump voters, are looking for. Don't undo things just because I did them.
Save Medicare, Medicaid, and Social Security without cuts. Have to do it.
Which is not going to happen, Anderson. But if the bill passed today in the House became law, thousands of Americans would die.
We think that the idea that we're going to allow the death spiral of Obamacare to continue, but we're going to subsidize it, is just not a very Republican notion.
What we have is something very, very incredibly well crafted. We don't have to talk about this unbelievable victory. Wasn't it unbelievable? So we don't have to say it again.
There are going to be major cuts to Medicaid, and people who have gotten coverage through the ACA may lose it, and people that have had coverage through traditional Medicaid may lose it as well.
Not Medicaid. You have to be poorer than either of us are. Because neither of us, we both worked and did not collect SSI, which is Supplemental Security Income, or Disabled People's Welfare.